Good morning, everybody. This is Mia Marvelli. I'm a supervisor with the Building Standards Unit here at OshPod. And we'll be starting the meeting. We're letting everybody into the waiting out of the waiting room right now into the meeting. So we'll give it just a second here. Still coming in. Okay. All right. We're going to go ahead and get started. So good morning and thank you for attending and joining our meeting today to discuss the Title 24 regulations for alternative birthing clinics. We have about 15 PowerPoint slides to go over today. They follow the agenda that has been posted online and available in the meeting invite. The first 9 slides or so are really about the purpose of this meeting and some background information. And we'll spend the bulk of the 2 hours today discussing the Title 24 regulations themselves. What we're going to do is I'm going to introduce everybody in the room here with us and a couple folks from CDPH that are on the line. And then we're going to turn our video off so that you're not distracted by what we're doing in the room. And Simrat will do some housekeeping discussions in a minute on how to participate during the meeting. So let me go ahead and move to the next slide and I'll do some introductions. So we've got Richard Tannehill here in the room. He's a licensed architect in California, and he's also our Deputy Division Chief of OshPod for the Northern region. We've got Larry Enright. He's our Senior Mechanical Engineer. He's also in the Building Standards Unit, and he will be going over the plumbing and mechanical regulations that apply to alternative birthing centers, clinics. We've got Clara Wu. She's a compliance officer in our unit, and she's also a registered nurse. And she comes to us with more of the healthcare perspective and patient care expertise. I've already introduced myself. On the line, we have Jamie Schnick. He's out of our LA office. He's our senior electrical engineer, and he'll be going over the electrical regulations later in the presentation. I have Simrat Pama sitting next to me, and she is our AGPA. It says staff services analyst, but she got a promotion, and she is handling all the interactions with the meeting, and she'll be working with you on providing comments and things like that. Also in the room, but not listed here, is a new person with us, Samantha Miller, and she comes to us as a senior architect, and she's also working on these regs with us today. So on the line with us today is Andrew, I'm sorry, I have it here, Barbuska. He's with CDPH, and he's the branch chief of the Center for Health Quality at CDPH. And we also have Nate Gilmore. Sorry, Nate, I didn't write you down. And he's a deputy director with CDPH as well. So thank you all for joining us. All right, at this time, I'm going to turn off our video and we'll move on to the next few slides here. Okay, so I'm going to move on. I'm going to turn this over to Simrat for some housekeeping items real quick.
Hi, everyone. I'll be going over the housekeeping rules. We'll be having periods for questions and comments from the public. So during that time, you'll be able to raise your hand if you would like to speak. If you're dialing in from a phone, please press *5 to raise your hand. I'll be able to view all the raised hands in the order that they're pressed. I'll then go down the list of raised hands and I will unmute you from my end when it's your turn. After I unmute you, you will also have to unmute yourself from your end, and then you'll be able to share your question or your comment. The chat for this meeting is turned off, so please wait for the Q&A sessions to raise your hand and unmute. Additionally, you should have an option to turn on closed captioning for this meeting if you would like. This meeting is also being recorded and transcribed. That's all I have. Thank you.
Thank you. Okay, moving on. So who are we and what do we do? So this public meeting is put on by the Office of Statewide Hospital Planning and Development, which we call ourselves OshPod, and we are within the Department of Healthcare Access and Information. We're the building department for hospitals, skilled nursing facilities, and psychiatric hospitals. We also have authority to promulgate regulations in Title 24, which is the building standards for these types of facilities. We also have authority to promulgate regulations for what we call OshPod 3 regulations. Those are for clinics. And that also includes alternative birthing clinics. And we'll talk about those a bit more in a little bit. So what we're focusing on today is the alternative birthing clinic regulations. When we develop these regulations, we coordinate with the California Department of Public Health because they're responsible for licensing. We've also been working with the Office of the State Fire Marshal for any fire life safety items, and also with the Division of the State Architect for accessibility regulations. Again, the purpose of this meeting, the big picture, is to right size, look for opportunities to right size the alternative birthing clinic Title 24 regulations. We're going to discuss those regulations. And of course, we welcome any input from you all on these, on what could be future proposed code changes. I also want to emphasize that in addition to the regulations that are in the California Building Code, which is section 1226.11 for alternative birthing center clinic, we also have associated electrical, mechanical, and plumbing requirements, and those are in other parts of Title 24. And I'll talk about that in a little bit later. So a little bit of background. We've been doing some research, which Clara will talk about in a little bit. And we recognize that there's increasing concerns about access to birthing services in general in California. And there's many factors that play into this. We also recognize that this is challenging in rural areas. Some of those reasons are hospitals have chose to close labor and delivery services since about 2012. About 56 hospitals in general have removed labor and delivery services. We also understand that birthing centers face challenges meeting the required Title 24 building standards that are necessary to be licensed by the California Department of Public Health. And the law associated with that is Health and Safety Code 1200 and 1204. So there's several types of birthing centers in California. One of them is a licensed midwife or nurse midwife holding an active professional license can register for a business license and provide birthing services in-home or at a birthing center. The other option is a midwife or a birthing center owner may choose to be accredited by the Commission for Accreditation of Birth Centers to bring their birthing centers up to the American Association of Birth Centers. We call that the AABC. Those are guidelines. And then lastly, a birthing center may seek CDPH licensure to become an alternative birthing clinic, which we're calling today as an ABC. The ABC needs to meet the OSHPD 3 clinic building standards, and this is what we'll be discussing today. So what is OSHPD 3? Title 24 contains the minimum building standards for all construction and alterations of buildings and structures in California. Not just clinics or hospitals, but everything. Title 24 is comprised of many parts, and just think of those as binders, if you will, including building, fire, electrical, mechanical, plumbing, and several more. Many state agencies have authority to promulgate regulations in Title 24. HCI is just one agency that does so for hospitals, skilled nursing facilities, psych hospitals, and clinics. Earlier, I mentioned that the Office of the State Fire Marshal, we coordinate with them. They have authority for fire and life safety, as does the Division of the State Architect for Accessibility. Those regulations also impact these built environments we discussed. So HCI and OSHPD amend Title 24, specifically section 1226.11 for ABCs. When we talk about the Health and Safety Code, we are talking about the law. And when we talk about titles, such as Title 24 or Title 22, We are talking about the California Code of Regulations. And lastly, the California Department of Public Health, CDPH, is responsible for licensing ABCs, and they promulgate Title 22 regulations. A lot of those regulations point to Title 24 if they're building standards related. Okay, I'm gonna turn this over to Clara Wu to recap stakeholder engagement so far.
Okay, thank you. So we had 2 meetings with ABC representatives earlier this year, 2025. The first meeting occurred on January 7, 2025. During the meeting, we discussed ABC environments and the challenges faced building an ABC licensed by the CDPH. We also discussed challenges faced compliance with Title 24, Title 22, and the standards for birth centers set by the American Association of Birth Centers. OSPA developed a Title 24, Title 22 comparison table, or we call the ABC requirement comparison table. During the second meeting with ABC representatives on February 4, 2025, we reviewed the ABC requirement comparison table and discussed regulations that can or cannot be changed. We also discussed opportunities for a guidance document and ABC checklist to help the ABC providers and the local jurisdictions. And we also conducted an email survey to both center owners. The results of this email survey will be discussed shortly in the next slide. Thank you. So on February 19, 2025, we sent an email with 6 questions as displayed in this slide to 31 birth centers. We received only 5 responses. I am going to just go over a couple of the questions and results, and we will make this slide deck available after this meeting, so you may review the details of this result later. One of the questions is about the size of the birthing centers. According to the responses from the 5 birthing centers, 2 or 3 birthing rooms in a birthing center are common. The size of the birthing center is one of the critical factors we may take into consideration. For example, some of the building fixtures may be required for a larger birthing center with like 10 or 15 birthing rooms, but may not be the same for a smaller birthing center, like with a 1 to 3 birthing rooms. Another question asked about the desire to seek CDPH licensure, which may inform us the urgency to modify or right-size the ABC building regulations. One of the 5 responses, or 20%, indicated no desire to seek CDPH licensure. This statistic shows that 80% of the birthing centers may want to get CDPH licensure, but the data is not large enough to make this assumption. We encourage you to provide your feedback to us. We'll post this slide deck on our website after this meeting, so you may copy these 6 questions and email your response to the RECT unit at hchi.ca.gov. If you would like us to email you the survey, please send your request to the RECT unit at hchi.ca.gov. This email address and more information can be found in a few slides later. Next, I'm going to talk about the ABC Title 24 regulation table. So I'm going to just provide a brief overview of this table and then turn it to my colleagues who will provide more information about the building codes outlined in this table. As you can see in the table later, the table contains 5 columns. The first column lists the required items for the ABC. We summarize the Title 24 requirements pertaining to that item. Following is the Title 22, which many of the Title 22 regulations related to space or building will reference to Title 24. We also looked at the birth standards produced by the American Association of Birth Centers. The very right of the table is the OSPD comment. As we mentioned earlier, we met with several ABC representatives to better understand ABC needs, challenges getting licensed, and their suggestions. We took their comments and edited the OSPD comment column for today's meeting. As you can see, some of the items are highlighted in rows. My colleagues will explain about it shortly. The table contains California building codes, California mechanical codes, California plumbing codes, and California electrical codes. So now I'm going to turn the floor back to Mia Marvelli, who will discuss the California building codes or the architectural components of the building codes.
Thanks, Clara. Before I hop into the Title 24 comparison spreadsheet, I just want to pause for a second. We do have a little bit of time, and ask if anybody has questions on the background, the purpose of this meeting, before we hop into this, because this next part will take quite a bit of time. Do we have any comments on that by chance? Any raised hands yet? You could go ahead and raise your hand, and then if you do have a question about the background or the purpose of this meeting, we'll unmute you. Go ahead.
We have a raised hand from Rick. I unmuted you, so you could go ahead and unmute from your end before you start asking your question.
Yeah, just a quick question. Why is fire not included in this, but it was in?
Can you hear us, Rick?
Rick, I see that you're
I can
unmuted,
hear
but we
you.
can't
Can you
hear
hear
you.
me?
So I wonder if you're.
Can you hear me? My mic is unmuted. Oh, wait, hold on.
Oh, we could hear you now. Sorry.
Oh, okay. So a real quick question. Why is fire not in this out of the other principles?
I'm sorry, why is fire not in this, or why are we not discussing fire?
Why
life
is California, why are we not discussing the fire requirements and using
Well-
California Fire Code or Life Safety 101?
Well, because primarily what we're here to discuss are the architectural features, the mechanical, the plumbing, and the electrical. That's what we have authority to amend. So the fire life safety requirements are done by the state fire marshal.
Okay. So it just falls under the normal fire code for building occupancy.
Yes.
And it's considered to be occupancy?
Yeah, I mean, for alternative birthing clinics, yes, primarily it would be a B occupancy. It wouldn't be an I2 because it would be a B.
Okay, thank you.
Yeah, thank you for the question. Anybody else? Okay, yeah, I turned my volume, just a housekeeping thing internally here. I turned my volume down because I kept getting pinged on okay, so I'm glad. Thanks for telling me I got to turn it back up. Okay, if that's all, we're going to move on. We'll talk about the architectural features that are in 1226.11. So as Clara mentioned, we have some items here that we'll call them highlighted in rose color. And some of these items are minimum standards we can't go any lower with. Some of these items are developed by the state fire marshal. And so we're calling these as we can't really change these amendments, but there's a couple nuances as we get through this comparison table here, where we may have an opportunity to clarify the information in a guide. And that's another part of our discussion today, is how the guide can help assist design professionals and ABC operators and possibly local jurisdictions with enforcement for these regulations. That's another, I don't think I mentioned this earlier, but primary care clinics and alternative birthing clinics, the local jurisdiction actually has authority for plan review, permitting, and inspection for certification of occupancy. OSHPD does not. So we try to assist where we can to clarify the regulations for the local jurisdiction. So I'm going to let me double check here. I'm going through my notes. Double checking some things during our meetings. So during our meetings with the ABC interested parties and after reviewing Title 22, which again is the CDPH licensing requirements, and after reviewing the American Association of Birth Center guidelines, we found that there were requirements that could be amended, such as the size of the birthing room, cleanup room, nurse call, lighting, garbage waste, medical waste, those types of things. We'll talk about those in a minute. Additionally, when all of the clinic regulations were developed years ago, the Facility Guidelines Institute for Outpatient Facilities was used as the basis for the regulations. In an acronym, the FGI guidelines are nationally recognized standards that many states adopt. While we are not required to use FGI guidelines for outpatient facilities, they are a good basis for the building standards. And we do use those guidelines for the hospital regulations. I'd also like to note that a couple of the architectural features that you'll see today overlap with the other disciplines, such as lighting and plumbing fixture counts. And so there'll be some overlap discussion on that. For the sake of time, I'm not going to go through all of the items, but I encourage you to comment today or send in specific comments by May 31st. And again, later in the PowerPoint, you'll see an email address to send those comments to. I'm going to scroll down here to Windows. So while we were comparing the various requirements, the need for a window in a birthing room may not be necessary, and we're going to consider this as a coach for a code change in the next code cycle. Later on in the presentation, I'll explain the code cycle, so let's, I'll do that. We also recognize that the regulations need to have some minimum requirements for new construction and repair. That said, we also understand that it can be challenging to remodel an existing facility to meet those minimum requirements. So similar to the clinic can, which is on our website, OSHPD wants to issue a guidance document for alternative birthing clinics that has similar intent to allow some flexibility for remodeling existing facilities. A slightly lower ceiling height is one of the items that would not impact the patient safety or care, so it could be considered to be somewhat flexible. Interior finishes and elevators is not something we'll touch on. Interior finishes is basically talking about where you can and can't have carpet and what type of finishes on the walls and ceilings and floors is required for infection control. Clara mentioned this already. Birthing rooms is obviously one that we will consider a code change for. So currently the regulation says a birthing room needs to be 200 square feet minimum with a 12-foot clear dimension. And that, but Title 22 just says an area that can accommodate equipment, supplies, and staff. Which is pretty open-ended. And then the AABC says an appropriate space for birthing. So when we looked at the FGI standard for birthing rooms, they recommend 120 square feet, which is quite a bit different from 200 square feet. So we will consider a code change for the birthing room. Location
To 120.
to 120. Yeah. Location of birthing rooms. This really is just meaning that it needs to be out of the path of unrelated traffic and under this direct supervision of staff. Nurse call is another item we're going to consider as a code change. We recognize that a lot of these birthing centers are quite small, maybe 2 to 3 birthing rooms, maybe less than that. And so in our discussions, we're looking at perhaps we can have some sort of a communication device provided in case a patient is in distress, or if one of the midwives needs to call someone else for assistance. But it doesn't necessarily have to be a complete nurse call system like many of us have seen in a traditional hospital patient room. Lighting we'll talk about a little bit later. This is another one where we may be able to reduce the foot candles to 70 rather than 100. Privacy is another item that just means you have to design things in a way that you're not exposing the birth room to an open area. Newborn care area is a carryover from FGI. And this area is actually optional, so we can clarify this in a guide. And then as we talk about exam rooms are not required in an ABC. And there's a lot of questions about consultation rooms. Obviously, a consultation room could be used, an exam room could be used as a consultation room. But what we don't want to do is if someone is only going to provide a consultation room and not have an exam room, we wouldn't want to have a higher standard for a consultation room. So we need to look at that carefully. There's a requirement right now for a nurse station, but there's clarification. There's room in the code that this does not have to be a standalone nurse station. This is actually can be. Sorry, I jumped ahead there. Oh yeah, right. There's a lot of areas that can be combined, such as a nurse station, reception, outpatient waiting room, medical records. That all of that can be combined into one area if needed, and that can be clarified in the guidance document. Then there's a lot of support services like clean utility, soiled utility, garbage, soiled waste, medical waste, and trash. There's also offsite laundry and housekeeping. These must be separated to minimize the risk of cross-contamination. This includes separating clean and dirty areas. That said, if minimal space is needed for housekeeping, let's just say there's a small amount of housekeeping needed in some of these smaller centers, then using a cabinet or a closet is fine. Same for clean utility and soiled utility. These can be small areas as long as they are separate areas. There's also requirements for, let me scroll down a little bit more. I'll hop back to crash cart in just a second. There's also requirements for ice making machine, nourishment areas, and staff break rooms. These can be combined and doubled as staff or break lounge. The ice making machine can simply be an ice maker in a freezer. We are looking at amending the public phone and drinking fountain requirements as they are a bit antiquated. I will hop back up here to crash cart. We've had some discussions, even though this is an orange, I think there's an opportunity here to make some changes. We can better clarify this as not like a crash cart in a hospital. What's needed is some sort of area where there's emergency equipment if needed. So that gets us down to, we've talked about general support areas. Those were kind of, I lumped those together. I'm scrolling down to the end of the architectural features. And what I want to do now is open it up for discussion. Next is mechanical. I want to open it up for discussion on any of the architectural features. And then we'll get into talking about mechanical, electrical, and plumbing.
We have a question from Sandra. I unmuted you, so you could unmute from your end before asking your question.
Can you hear me?
Yes.
Okay. This isn't specific to what you had just discussed, but something you stated earlier about the local jurisdiction responsibilities. And I missed the third one. I heard plan review, permitting, and what was the third area?
Oh, sure, yes, certification of occupancy. So once the construction is completed, the local jurisdiction will come in and do, a certification of occupancy, allowing the folks to move in and start working. After that, though, and what's important is CDPH still has to provide a license for the ABC. So that's a different form through CDPH.
Okay.
Form
Right.
I'm sorry, Form 270 is on their website if you need to look for the form for licensing.
So I guess a follow-up to that, is there
Sure.
a state role in ensuring uniformity among the local jurisdictions, or is that totally independent?
That is independent. One of the reasons we issue guides, code application notices, and checklists is to help them with that. We do field a lot of those questions. We can't intervene on a local jurisdiction, but we can offer assistance if they ask us for it.
Okay, thank you.
Yeah.
We have a question from Glenn. I unmuted you, so you could go ahead and unmute as well. Glenn, I don't know if you're talking, but you're still muted, so you're gonna have to unmute from your end.
Anybody else? Well, we can come back to Glenn, but we still can't hear you, Glenn. No other questions? Okay. Well, we can move on to the mechanical overview then. I'll scroll down for Larry. We can always come back if we have time, so we can come back later. You don't have to.
Hi, I'm Larry Enright, Senior Mechanical Engineer in the BSU. Provide the plumbing and mechanical overview. So just a quick intro. So OSHPD includes amendments for plumbing and mechanical to the model codes to make the California code related to healthcare facilities. So many of these amendments are based on guidelines either from FGI for plumbing or ASHRAE 170 ventilation of healthcare facilities for the mechanical requirements. OSHPD adopts these guidelines based on the OSHPD designation and for plumbing mechanical amendment for the OSHPD 3. So these apply to all clinic types with surgical clinics treated separately in our amendment package. So feedback on these amendments are appreciated as we will be looking into the applicability of these amendments for these lesser city functions. And then there's also minimum code provisions and the model codes that apply to ABCs and cannot be reduced by OSHPDs. However, we can provide specific applications or recommendations in our proposed guide.
Keep going.
Right there.
Okay.
So starting at the top, one of the amendments we have, so outside air intakes. This looks for a distance of 25 feet. So other vents or exhaust. This is just to provide additional safety for outside air. So model code permits down to 10 feet with objectional sources up to 25 feet. Down to the CMC table 4A is based for ventilation rates. 407 looks to have a continuous operation. So we have already built in exceptions for unoccupied modes. So when the area shut down, the HVAC can also be shut down. So that's already built in our amendments. The table 4A ventilation rates are also based on ASHRAE 170, which includes berthing. Those are pretty much to make sure there's an additional layer for health related functions. This also addresses space pressurization for clean and dirty spaces. And that's really similar to how in a residential space that either a toilet, shower, or laundry rooms, those are all exhausted areas and they provide a negative pressure. This table for just kind of fine tunes what these airflow rates are supposed to be. And when those spaces are supposed to be positive or negative. One of the other amendments that comes into play is plenum spaces. And so there are OSHPD amendments, but there's also some model code language that prevents plenums for use in healthcare facilities. But any comments we appreciate on moving forward as we look for not just ABCs, but clinics in general.
Keep going.
Yeah.
Okay.
So room transfer is a provision. Typically, don't transfer from one patient space to another. Filtration, we have CMC 408.4. We look at specifically for the ABC space, but this is an area that will also address specifically natural 170. One other component that comes up is air duct. There's a lot of model code requirements. OSHPD does have an amendment that allows an extension of 10 feet for these flexible ducts at terminal unit devices. All the code applications with ABCs would also be looked at for the guide. And then moving on to part 5, plumbing.
Or do we want to ask questions, bro? Let's ask
do that.
question mechanical real
Okay.
quick. We have time. We have a lot of time, actually.
So if there's any questions, please raise your hand from the mechanical side.
All right, let me scroll down to plumbing.
So plumbing is in separate part 5. Some of the main features that also duplicate out of the part 2 building code. So hand washing fixtures. CPC just generally defines the fixture requirements, how to put together and base a hand washing fixture. Plumbing fixtures. This comes into play as in we bring in the FJ requirements for having separate facilities for staff, patients, and toilets. Public toilets. And the main point right here is this one on a small ABC. This brings in additional fixture requirements. Basically, you have an addition of regular occupancy. For clinics, we have an exemption for less than 3 exam rooms. These will allow the public and the patient to share. However, the challenge with that is that you can see the patient toilets are typically in the birthing room, private to that birthing room. So comments in that area will be helpful as we evaluate a fixture application for that. It's occupancy.
Nancy is okay.
Okay, a couple more pieces.
Do you want Nancy to ask?
Yeah, we can, you only have a couple more.
Yeah.
We'll open it up for
Let's do
questions
one.
right after. Yeah,
Okay.
thanks.
So puddle water, 6041. So CPVC is not permitted under OSHPD 3. This is a kind of tangent. So we do have chapter 1 allows existing materials to remain. So if there's a rebuild, but for new construction, this is one of the state of California requirements. In addition to the sanitary drainage, ABC and PVC installations, those looked at changes and those will tied in. So those are marked in red. Hot water distribution, we have CPC 613.6. This is for one that's for scouting, and then also 1613.2. Looking at scouting issues and also regional issues. So redundant equipment is required in 613.2 to maintain functionality. We've looked at clinics for smaller type facilities for water heaters that might be a little bit easier to change out. So any comments there would be cool. And that's pretty much the main amendments related to OSHPD. So if there's any questions, we'll take those now.
Nancy, I unmuted you, so you could go ahead and unmute and ask your question. I'm not sure if you're speaking, but you're still muted, so.
We got some hands up. I hope we can get somebody.
Yeah.
We're not having a problem. I think we're okay.
Okay, it looks like Nancy put her hand down, so I'll move
Okay.
on to Ezra. I just unmuted you, so you could go ahead and unmute to ask your question.
Okay, thank you. Yeah, one question that I had that I had a problem recently going along using the primary clinic checklist that OSPOD provided. One of the local jurisdictions was fighting me about the number of toilets required and kind of fighting between the verbiage and the different code sections, especially the plumbing code, in relation to, you know, needing staff and public and patient toilets, and then also needing male and female. And so it would be helpful, I think, if the checklist for this, if you create one, and just the clinic checklist provided a little bit more clarity about the minimum number of toilet rooms required for a smaller facility. If you meet these requirements, then the minimum number is, I would think 2, but they were forcing us to do 3 because they wanted male and female for the staff. But that was an issue that I think warrants clarification.
Okay, thank you. Yeah, we're definitely looking at that with, generally the limits work really well with larger facilities. Looking at staff, we're looking at whether staff such as if they're singles, if you mark all gender anyways, and whether we can get down to a single for a certain number of occupancy, 5.
Yeah.
Couple different laws and regulations that come into play, guidelines and state requirements. So that's definitely something we're gonna be looking into addressing and clarifying in these next code changes and the guide. Thank you.
Thank you for your question. I'm moving on to Glenn. I just unmuted you, so go ahead and unmute to ask your question.
Glenn, we can't hear you. So if you're talking, we still can't hear you. Sorry.
On the top right hand of your Teams meeting, you should see the option to unmute, just in case you can't find it. Okay, I'm gonna move on to the next question, and then Glenn, we could come back to you in case you need to figure out your settings. Rick, I just unmuted you, so you could go ahead and ask.
Can you hear me?
Yes.
Okay, just an FYI for people who have not unmuted or are not able to speak, there is a secondary button on the bottom for the first, each time you do it for the first time, where you have to accept the unmute. FYI, not just the upper right mic, but then there's another one that pops up. Okay, that was it. I would just make a statement for the people that are trying to talk and you're not hearing them.
Thanks for that, because on our end, we don't see that. So thank you for that.
Yeah, no, it's in the lower. Okay, now I'm going to lower my hand and shut up.
Thank you. Glenn, you want to try again? Anybody else with their hands raised? Nope.
No.
Okay. All right. So we've got through architectural features. We've got through mechanical and plumbing. Jamie, we're going to turn it over to you and to go through the electrical features. Oh,
I did get an email that the unmute is not working. Can you enable the chat? Should I?
Can we enable the chat? I think my concern with the chat is that we might not be able to address all the chat items, but what we can try to do that, we can collect them too, right? And we can answer after the meeting if we don't get to them all. Okay, yeah, we'll enable the chat. But I am going to turn this over to Jamie. There's only a few electrical items, and then after we're done with this, we'll still want to engage and discuss this table because we only have a few more slides left and we have plenty of time. So we'll start collecting those chat items as well. Jamie, I'm going to turn this over to you.
Great. Thank you. Hello, everybody. Jamie Schnick, Senior Electrical Engineer with OshPod and part of the Building Standard Unit. So really just 3 items I'm going to go over that are included in the California Electric Code. Number 1 is the requirement that all branches circuits serving patient care spaces shall be provided with effective ground fault current path. This article, California Electric Code 570.13 A and B, requires that number 1, the circuits be routed in a metal raceway is A, and number 2, B, that all of the circuits have a ground wire. So this is, the code only looks at what is taking place and basically requires when there's patients that the receptacles and equipment adjacent to the patients be served by circuits that have these 2 grounding paths. This is something that the code requires, and it's something we could look at if it wanted to be relaxed. Number 2 is the artificial lighting, and California Electric Code requires that all rooms have lighting. Pretty simple, but it also requires the illumination intensity levels meet the recommendation of the IES recommended practice 29. So typically we would see this would be in the range of 70 to 100 foot candles. Right now, we see that the California Building Code requires 1,076 lux, which translates to 100 foot candles. This is different than what we would see from the ABC, alternate birthing clinic recommendations would be 70 foot candles. So again, it's not really an excessive requirement, but it's something that could be looked at. And then the other one is the call systems. And again, our code requires nurse call devices installed per table that's in the building code, which specifically list delivery rooms and birthing rooms requiring a nurse call station. This is to allow people at the bedside to be able to, including the patient, to call for help. And again, if there's no nurse station, this kind of becomes a questionable requirement. And I think that's something that the group is going to be looking into. Electrically, those are the 3 items.
Thank you, Jamie. I also just want to mention at the end of this comparison sheet are links to several resources that we utilize to put this together. And so right now, I'll ask, excuse me, are there any questions relating to the electrical sections? And if there are not, we can move on to any comments we started receiving as well. No electrical questions? Okay, all right. So did we receive any chat comments? Okay. Let's see. This one? The last one. Okay, Glenn, I'm going to read your comment. Thank you for that. I was surprised to see that the comparison table did not include a direct comparison of FGI for ABCs as the acknowledged national standard for health facilities. This may be advisable for consideration, particularly in the area of architectural mechanical. Yeah, I agree, Glenn. When we started this comparison table, we were really looking at Title 22 and the AABC, which is part of the requirement in law. And then once we dove into this, we realized that a lot of the requirements in 1226.11 are actually based on FGI. So we will also consider what's in FGI when we're looking at making any of these changes. So I hope that helps answer that question. Is that the only one? Okay. And your comment is look at the current FGI, right? Will do.
Can you respond to that? Thank you.
Uh. Couldn't understand.
Yeah, the question on toilets.
Oh,
it's just to
okay.
reiterate. So-
Okay, Nancy, all right, sorry. Nancy has a question on, she couldn't quite hear the person who spoke on the plumbing regarding the toilets. So yes, sorry, go ahead, Larry.
Yeah, just the current code requires staff to be separate and not shared. And with ABCs, the clinics currently allow the patients and public to share for small facilities. So the public can't share the patients. Also evaluate whether these small facilities can be staffed or not. That would have to be under comment for consideration. We're looking at the overall picture count,
Right,
how to achieve these. So any comments, additional comments would be helpful
yes,
if we're looking into this.
okay. And then Bill Zomer has a question. He's recommending, are you recommending that we provide a definition for birthing room? Question on definition for birthing room and maybe other room names, since there is no definition in 1226. Should they be added there? Okay, yes, we can take a look at that too. And then Ezra has, I would say the code minimum for small, tiny clinic restrooms would be 1 staff and 1 shared public / patient. But several jurisdictions have looked at the CPC male and female requirements and interpreted those as meaning that 4 is the minimum. Yeah, we're aware of that, Ezra, and we'll, that's one of the things we're looking into. And I think Sandra's saying maybe she couldn't quite hear at the end of the table. So when we'll just, okay. Thanks, Bill. Got it. Okay. I think we have another. So I think what we're getting now is we're getting comments on questions in the comments. So if you have a question for us, you could direct it to us. I was leery of having a comment, the comment being open, because it generates discussion amongst each others, which is, it's fine, but we can't answer some of these questions. So Melissa asks the question, so for shared toilets, would a separate toilet for patient inside the birth room and a separate toilet for staff be acceptable? That's one of the things we're looking into, because it's our understanding that in a birth room, you're going to want to have a toilet in that birth room for the birthing mother. And then there would need to be separate toilet facilitations for staff outside of that birthing room. And then we have another issue where we have the public. And if there is public in there, they need to have their own separate restroom as well. So that's one of the things we're looking at. So one of the questions is, will the copy of the presentation be available? Yes, we're going to add it to the website where this agenda is available. We wanted to fine tune it before we loaded it. So the presentation will be made available.
And the website link is in the meeting invite that you used to join the meeting, in case you forgot where the link is.
So Bill asked, can you please re-explain the licensing requirements? What are the options? And do all of these have to be licensed by CDPH? If not, then would it just fall into model code? So yeah, let me, I'm not going to get too much into licensing, Bill, but let me scroll back up to this slide. So there are already, use the right terms. There are already midwives that are use their professional license and provide birthing services to mothers. And they may or may not do that in a clinic. That clinic would not be licensed under CDPH. Then there are birth centers that are accredited by the Commission for Birth Centers. Those are also not necessarily OSHPD 3 licensed by Title 22, licensed by CDPH via Health and Safety Code 1204.3. So that you are correct, those would be standard model code requirements. Does that answer your question, Bill? What do we have there?
She raised. She
Oh,
also asked that question.
Sorry,
She
we
just
have a
didn't-
raised hand as well.
Melissa, I enabled your mic, so you can go ahead and unmute. She said her mic will not unmute. Hopefully you can drop it in the chat.
Mhm. So Rosanna asks, but can staff and public have a shared restroom? I can't answer that today, Rosanna. There's some other things we need to look into because there are some other requirements that we have to separate staff from the public, but we're looking into that for smaller clinics. So this is one of the things we need to research over the next few months.
So any comments pertaining to arrangement and how they be unlicensed, how they're set up and how they operate with restroom usage would be helpful.
Okay. Bill?
Bill, I just enabled your mic so you could unmute and ask your question.
Okay, can you hear me?
Yes.
Hey, okay. I was thinking that's not going to work, but it did. So yeah, the question I'm kind of driving at, the licensing and the definitions, if somebody chooses to not be OSHPD 3, but has a birthing center, then all that stuff in 1226 would not be applicable. And so maybe the definitions as they are developed, and I think it's fantastic you're having this meeting and diving into this. Just make sure that the definitions will be, I suppose, in chapter 2, so that when somebody does a model code birthing center, the birthing room has a definition that applies. And all the other stuff, I suppose, too.
Yeah, I think what we need to do, I mean, this gets into like the charging language and the general statements within those sections, is I think what we need to do is make sure that it's clear in 1226, which it is now, that these are OSHPD 3 licensed facilities. And maybe the guide helps with this too. If you're seeking licensure through 1204.3. If you're not, then you don't need to apply 1226. I think we can't opine on what the requirements are for these other birth centers. We won't call them alternative birth centers. We'll just call them birth centers, because there still are some requirements that they have to comply with.
I understand. We end up with a similar problem with the surgery center. If you don't go through CDPH, there's no minimum room size. There are no requirements. And it's a really weird code situation.
Mm-hmm.
Okay, thank you.
Yep. Thank you, Bill. So Glenn asks Mia and Larry, on mechanical, note that current ASHRAE 170 addresses outpatient facilities, ABCs and primary care. OSHPD table 4A does not. You want to?
Yeah, thanks, Glenn. We also have primary care public meetings. We're looking at the outpatient requirements, and table 8182 of ASHRAE 170 will be incorporated into the next supplement for Table 4A. So we are looking at getting the specific more functions listed in Table 4A. One of the current arrangements more back to 1226 that you're familiar with is that the primary care section does not technically list out a lot of functional uses. They kind of refer back to 1224. So kind of tie those together to make sure the part 4 and part 2 are talking together. Thank you.
And I see Melissa's asking a pretty specific question about a birthing center that she owns. I think we might have to talk offline about that. That is kind of more of, gets into the weeds of mechanical discussion. So maybe Melissa, if at the end of this presentation, I'm going to show a slide. Actually, I'll just scroll down there right now for you all. We're going to go through some more slides here, but I want to encourage you all to send feedback to regsunit@hchi.ca.gov. And so, Melissa, maybe you could send a separate email and we can get back to you on that.
And just to follow up on that, we currently have the primary care clinic guide. We're working on the ABC guide, and then so the different functions will be listed in there, and then we'll more clearly help with outlining which ventilation requirements are for each space, and then looking for code change for the future to get them more aligned with the specific name functions in Table 4A.
Okay. So just give me a second here. I'm reading another comment that came.
Yes, so the clean dirty areas, typically the dirty spaces are looking for 10 air changes. So that's based on volume of the space, like getting enough CFM to make an air change of that space. So 10 air changes of exhaust. The clean rooms, depending on which space you're in, some are 6, some are 4. We'll, again, try to get that more clear in the EDC guide coming out.
Okay. All right. We'll leave the chat running. I think I'll take a couple minutes to go through a few more slides here. So this homework we have is we do want your feedback. We would really appreciate if you have specific technical documents or articles relied upon as a basis for your proposed code changes or ideas. Any law citations that you know of that would be helpful so that we can use that when we're looking at our code changes. Again, we ask that you send those ideas and comments to the regs unit at hchi.ca.gov. Again, we'll make this available on our website. And it would be really helpful if you could use the subject line ABC public meeting. That would help us filter through the comments that we're going to receive. That regs unit email address that you see there, we receive technical questions there all the time. So it would help us sort through those. And then, as I noted here, here's a link to the ABC meeting materials that'll be made available. I want to give you an overall of the timeline for this code cycle and what we'll be doing in the coming months. So today was our first ABC public meeting. We anticipate that between June and August, we're going to prioritize a lot of other code changes. We're not just working on ABCs, but we're going to prioritize and draft the code language. We're going to make that available to our interested parties. So the same way that you received this meeting notice, you're going to receive some draft regulations specific to ABCs, but also specific to other code changes we may be working on. We would appreciate your feedback on that. When you receive that email, we'll have some instructions on there of how to respond to that. And then our role internally is we're going to be working on an ABC guidance document. So many of the comments that we received today, we would greatly appreciate ideas on what would help you in a guidance document and a checklist. So please feel free to send that to us by May 31st as well. And then We are required statutorily to do things by certain timelines for rulemaking. So we have to have all of our work complete internally by October. And then we send our regulations to what a state department called the California Building Standards Commission. And it's required that we send our changes to them by December of this year. And they run what's called a formal rulemaking process to amend Title 24. And that process will occur between December of this year and July of next year. And then any regulations that are approved will be published January of 2027, but they won't take effect until July of 2027. So that's called the supplement to the 2025 code. And that's the timing of everything right now. So we have a very short amount of time to do this work to set the stage for a much larger and longer rulemaking process. Any questions on that before I move on? I'm getting a question here. We've got a couple questions. Any idea why survey responses? I actually, we don't have any idea why this survey response was so low. We sent it out to 31. We had the names of 31 different facilities. We would be happy to send out that survey again. Or like we said, if you know of people that want to perhaps now see that survey, they're welcome to send in more information for us. I think that would really help our cause. The next one, I'm sorry. Okay. We're gonna. So we actually. Sorry, I'm just reading comments right now. So we actually have a list of quite a number of midwives, and this was sent out to all of them. So we received that list from. Sorry, Claire. I'm looking at Claire.
From the AABC committee,
right?
yeah, the
right.
committee,
Right.
people. Mhm. California.
Oh, Larry to Glenn to Larry. Okay. Can the public participate in the June-August draft code changes? Actually, thanks for that question, Rick. Actually, what we're going to do is it's internal. It's with staff because we're working on not only ABCs, but we're working on a lot of other code changes for Chapter 12 in general. And so what we're going to do is send out that draft language in, I think I said August sometime. So that's when we would want feedback.
And then this is, of course, the initial, getting comments from the public is
Right,
will help drive where we go,
correct.
and where we'll provide those out in the comment times.
One of the things I want to mention, I don't know if I have it on here. It's been talked about. So in addition to this ABC meeting, which is within Chapter 12, which is in Section 1226, we're going to be conducting 2 public meetings that are more geared toward primary care clinics. And so this same, it'll be in a format similar to what we did today. That first meeting is going to be in June, and we'll probably have a meeting later in August. So it will be another opportunity to discuss primary care clinics in general. We won't be focusing on ABC at those meetings, but as you can see, there's a lot of overlap with ABCs and primary care clinics in terms of the regulations and the restroom discussion, the mechanical discussion, those types of things. So we will have 2 more public meetings. The guide you create is similar to the A2 guide created for pharmacies where other than, okay, let me read this out loud. If the guide you create for ABCs is similar to the A2 guide OSHPD created for pharmacies, where other code requirements are shown, for example, with pharmacies, it's USP. This would make the guide useful for jurisdictions to make sure they know requirements for non-OSHPD 3 birthing clinics. Okay, yeah, Ezra, I think we're going to be careful not to give recommendations for what is a non-OSHPD 3 birthing clinic. We really can only provide guidance on OSHPD 3 birthing clinics. Nancy has a question on who did the email come from? I can't find it, and I was in the original meeting.
Yeah, we have an email blast from our Oshpod.
Yeah,
But the second comment, the same thing. Well, yeah, we'll have to definitely be in contact and we could make sure that that goes out.
so we sent this email out specifically to the list of ABC people we were working with previously, and then we also sent it from our listserv. So there should have been 2 emails that got to most of these people.
For the meeting, are you
Yes.
talking about the survey?
No, the meeting.
Oh.
Yeah. Are they talking about the survey?
Survey.
Oh, okay.
Yes.
Sorry.
The survey come from my email address.
It came from your email
Yeah.
address. Okay, Clara Wu. It
Right.
came from Clara Wu at hchi.ca.gov. The survey came from there. So Melissa says, both Nancy and I are on the board of the California chapter. If you send us the poll directly, we can make sure the birthing centers in California are made aware of it.
We did send to them.
We did send to them, so, okay. Yeah.
Yeah.
Okay. All right, so let me just pop through here really quick. Let's talk about the guidance document for a few minutes. So the intent of the guidance document is to assist design professionals, alternative birthing clinic owners and operators in the local jurisdiction on compliance with the current edition of Title 24. So current edition of Title 24, not the future changes, because we recognize there's going to be a gap between now and when the proposed code changes will be in effect later. The checklist will provide a list of the applicable building code sections. And we hope we have a date on here of June 30th. I'm not sure, that's a pretty aggressive schedule, so I'm not sure it'll be ready by June, but we'll work on that. I think we've kind of covered a lot of the things in the questions of what would help us in the guide. But we do look forward to any input you have on what would be helpful in the guide. I think Ezra had a few things. I think perhaps listing the licensing in there would be good. And then I have, thank you for the focus looking. Let's see. Oh, okay. Yeah. So Sandra writes, thank you for the focused look at ABCs versus primary care clinics. There has been a challenge in a misunderstanding of the role and function of an ABC versus a primary care clinic. Yes, they are not the same and serve very different purposes. Yeah, that's one of the things we were looking into when we were reading the law. And so I think that would be actually really helpful in the guide and also when the layout of the regulations. I think the tricky part is what we're also learning is a primary care clinic could have an ABC in it. So we also have to recognize that as well. Any other thoughts? I'm going to leave it with thank you for your feedback and regs unit. We have a hand up? Okay.
Jessica, I enabled your mic, so you should be able to unmute and ask.
Okay, can you hear me?
Yes.
Yeah.
Okay, great. Oh, phew.
Yeah.
I just wanted to make a general comment to follow up Sandra on her point. I'm a researcher at UCSF, and our team has been studying community-based midwifery care for a number of years. We've spoken with over 100 community midwives in the state of California, and a lot of them have been trying to run birth centers for many years. Many of them also provide care out of their homes. And I know there are a lot of midwives in this room right now, so I will leave the specific sort of points and requests to them, but I just wanted to share a broader sort of comment for you all as you're continuing to develop these standards, because midwifery care that is based in the community is a very specific and unique scope of practice that isn't serving to replicate hospital-based care. And so when you all are designing, right, the protocol that people will have to follow in order to operate birth centers, I think it's really important to at least hold that understanding that, you know, these midwives are also providing very effective, safe care in people's homes, which are not standardized settings. They are not, you know, they're as far from a hospital as one could imagine, right? And so in my opinion, that's almost a better place to start in your imagination, right? Rather than thinking about the predominant obstetric model that is based in the hospital, at least just as a thought guideline or exercise as you're going through this. The other thing that I want to say that we've learned from our study participants over the years is that these governmental systems and requirements are unimaginably burdensome for them. And that is one of the primary reasons they're so, it's so difficult for midwives to maintain birth centers, because they are not resourced the way hospitals are resourced. It's often 1 or 2 midwives who not only provide all of the care that they're providing in their community, but they are in charge of every administrative aspect of running their business, sometimes including a birth center. And so the more straightforward these guidelines can be, or these requirements can be, the better chance midwives are going to have to be able to run a successful birth center in their communities. I'll leave it at that.
Understood. Thank you, Jessica.
Mm-hmm.
I have another question. Okay, yeah, these are comments. Okay. Yeah, we'll take this. Mm-hmm. Okay, thank you. Okay. Any other thoughts? Great, thank you. Well, we'll give you back some time. Thank you for your participation today. This is an important part of our process that we do. We understand the complexities with this, and we are here to help. I think that there are different challenges. We're also understanding there's different roles that the different types of centers play throughout the communities. If you are, I was just going to say something about all that. If you have questions about how to receive meeting materials or anything like that, send it to the regs unit and we'll tell you how to get on our database if you're not already on our database. And watch for future meetings regarding primary care clinics as well, please. Thank you very much for your participation today. We really appreciate it.